that has been given. So you always analyze the case before you present it to the examiner. This patient has got 65 years, which belongs to the geriatric age group, and he has 90 pack years, because 2 packs per year is into 45 makes it 90 pack years of smoking. So all the ill effects of smoking will be there. History of ICU admission 3 times in the last 3 years, suggestive of chronic bronchitis, and posted for laparoscopic surgery, creating carboperitoneum, which again has got its own problem of increasing the CO2, which is already high, as well as the cardiovascular effects. Then in the history taking, you must first always analyze an geriatric patient between the chronological age and his biological age. As I told you in the earlier class and showed you the pictures, sometimes patient may be saying he is 80, but he may look like a 60-year-old because he is well preserved, he doesn't have other comorbidities, he may look much younger. So always assess the chronological versus biological age. Then look for smoking related complications like chronic irritable cough, sputum production, and any history of ischemic heart disease or ischemic anginal pain. All those things you have to ask. And then the duration of COPD, his effort tolerance and treatment taken. And for gallstone related pain in the abdomen, whether they had any jaundice because of the gallstone moving and obstructing the common bile duct, and any history of nausea and vomiting still present because of these things. And examination, always look for, because you have made a diagnosis of chronic bronchitis, see whether his appearance fits into that blue bloater description, whether nicotine staining in the fingertips, and systemic examination of RS CVS abdomen should be done. Then preoperative, routine pre-op investigations for any surgery which you do, and pulmonary function test if needed. You must be able to answer on 6-minute walk test, and then the ABC values that you are likely to get, and risk stratification using GOLD criteria or BORD criteria. Then pre-op optimization, most important is smoking cessation, and all the duration, all that questions will be asked only during that time. Incentive spirometry, chest physiotherapy, antibiotic cover, sputum reduction, and bronchodilators. Then intraoperative management, usually GA with ET tube or second or third generation supraglottic airway devices, plus a regional anesthetic technique is always preferred. For that regional anesthetic technique, you can use commonly thoracic epidural anesthesia, or a tab block, or rectal sheath block, or port site infiltration, or intraperitoneal instillation. All these things are the common methods of regional. Very, very severe cases, if you answer very well, then you can go in, say, segmental spinal or epidural, or thoracic paravertebral block, or erector spinae plane block, or in high risk cases can be examined. I mean, if they ask you, you can mention that, otherwise try to avoid answering that. And drug commonly used are for induction propofol, etomidate, and ketamine, especially as I told you, etomidate for patients with right ventricular dysfunction. Relaxants, rocronium, vetronium, or cisatracterium are the preferred drugs. Analgesic, paracetamol, fentanyl, tramadol, dexmedetomidine, lignocaine, and ketamine, and magnesium sulfate also. Inhalation agents, CO, iso, and halothane. Of course, halothane is the last, it's not used common in particular case. Okay, good. Well done, Sunita. You done a good job.
Thank you, sir.
Welcome. Any questions or any doubts by any students? Of course, in this topic, if you get it, you should be very thorough in the basic anatomy, physiology, parts of the respiratory system. That's a very common way of making you get nervous by asking the basic things. So don't be expecting that always they will ask you only about the management of the case. They can suddenly jump to the basics and go to ask you about the anatomy of the tracheobronchial tree, the various lung volumes, pulmonary function tests. These are all questions that can be asked. So, for want of time, I am not able to discuss all that now. So, keep them also in mind. Try to read up so that you will be not caught unaware if they ask you suddenly about those things. Okay, right. Right. If you don't have any questions or doubts to be cleared, then shall we move on?